Hi, everyone. Welcome to our Doctors in Politics Facebook Live with our candidates this evening. We're super excited to kick off a series of Facebook Lives where we meet with physicians who have run for public office, who have held public office, or who are currently in public office at all levels of government, to share with you all why it was they decided that doctors had to run for elected positions, why they decided they themselves felt it was the moment for them to run specifically, what some of the barriers were that they faced in their runs, as well as some of the barriers that they face currently or formerly in elected office, and some of the successes that they defined for themselves in serving, and how they made those things happen. So we thought this would be really useful in this moment because with this pandemic, there has been so much frustration among physicians, and I think a desire to do something, but a lack of information on how to change the systems that are really challenging us. So I wanted to introduce the three people we have today. They're representatives from different levels of government. We have two elected officials currently with us and one person who ran for Congress who will be serving in the Biden administration with the COVID-19 task force. So we're very privileged to have Lisa Reynolds, who is from the Oregon State Legislature. She's a pediatrician there in Oregon and newly elected. We have Matt Hines, who's on the Pima County Board of Supervisors in Arizona. And you're internal medicine, correct? Is your background? Yep. And then we have Cameron Webb, who I believe also is internal medicine in Virginia, and he ran for Congress and will be joining the Biden administration in DC. So let's just start. Maybe we can just kind of go round robin. I'll pose the question, and if you guys could each give like kind of brief answers, and then we'll maybe leave a little bit of time at the end. I'd like to try to wrap up still at the top of the hour, and I know that we ran a little bit late because of the technical issues. So we'll try to go fast here. So Lisa, I guess we'll start with you. Why did you think, or did you even think, that this was a moment that doctors specifically should be running for office?
Thank you. Thank you so much for Doctors in Politics for being here and the support during the campaign. So I got into this campaign in October of 2019. So, 3 or 4 months before the pandemic hit. And I really did run saying, as a pediatrician, I know what's working for families. I know how I know what we need to do to make life better for Oregon families. And with almost a third of Oregon's budget going to healthcare, don't we need more healthcare experts in the legislature? And then, of course, with the pandemic, that just became the complete theme of my campaign, and I think was pretty compelling to people.
Mm-hmm. And Matt, how about you at the local level? Why did you feel that physicians in particular would be good serving in those offices, or specifically on the Board of Supervisors?
Sure, and very similar to Dr. Reynolds, I had previously been in the state legislature in Arizona back in 2009 to 2013, and spent a couple of years in the Obama administration helping to roll out the Affordable Care Act. So I have been, as a healthcare professional, involved politically as well to work on policy to obviously help our patients, families, and communities. I made a very last-minute decision, pretty specific to the pandemic. It was not until the very end of March, and I think our filing deadline was April 6th. So I gave myself a week to get the signatures to run for supervisor, because Pima County, which is southern Arizona and Tucson, basically the 5 supervisors in Pima County oversee the county health department, which is currently, as you know, tasked with rollout of the vaccination, putting in place infrastructure, viral surveillance, testing, contact tracing, and I thought was just not prepared to do something of this magnitude of to deal with this catastrophe. So my voters responded, I think, similarly with regard to Dr. Reynolds and her comments just now. And I won. Actually, I defeated the chair of the Board of Supervisors by almost 20% in the primary, which is kind of unheard of. And then my district being a bit more Democratic leaning, I didn't have any trouble in general. So that's how I got in here.
Excellent. Wow. And Cameron, how about you? Why did you decide to run for Congress? And when was the moment that you decided that? And why did you think doctors should be, considering a run for Congress?
Yeah, well, a lot like Matt, for me, I've been in and around politics for a while, worked in the Obama administration. I actually worked on open enrollment 4, so we were probably on different ends of that spectrum, but worked at the end of the Obama administration and kind of being in government, seeing, what we can do from the executive branch, it really kind of opened my eyes to the levers of government we could be pulling to really, affect some real change for our patients. And so for me, really what it was the imminent threat to the Affordable Care Act, in 2019, when we were seeing that case that's now, California v. Texas, that could strike down the entire law. And I was like, we need, people with this background in legislative settings to help protect our patients, And I think it's similar to Lisa and Dr. Reynolds, the idea was, once the pandemic hit, the pandemic was what everything was about. And I think that, that really took on a life of its own in the campaign. And I think we just, made as many arguments as we could for why having this kind of expertise is so important. And of course, I fell short in my race by, 20,673 votes. Who's counting? And I think, for us, we felt like, we were able to make some really good arguments along the way. And, we elevated those issues of, the importance of talking about health in Central and Southside Virginia. So really, really proud of the race we ran.
Let's go in the opposite direction now. So Cameron, starting with you, why did you think that the moment when you decided to run was a good moment for you personally to run for office? How do you think it will help you personally? How do you think it will help your community specifically, that you are a physician representing them? I guess you won't be representing them in the same capacity that you thought you might be at this point, although appointed positions are also really, really crucial, that physicians occupy those as well. So what are your thoughts there?
Yeah, and I think it's interesting because whenever we talk about moments or when you got into politics, I tell folks it took 6 months for us to make the family decision to run for Congress, right? I started off from having never run for office before and saying, should I do this? Could I do this? Did the whole health out of it, and if I could talk myself. And I think that as I were having that conversation, just at every turn, I was just like, this is the right moment to have these conversations, to lift these issues and to do it from this vantage point. And so it was really important to me. And I think that you learn a lot going around a district that's bigger than the state of New Jersey, meeting with folks and talking to them about all the challenges. It's using that doctor skill set. You walk in rooms, you ask people where it hurts, you listen for an answer, right? It's the same skill set. And so it just felt natural, felt right the whole time. And so I think that, for me, it was a series of moments, but just a lot of affirmation along the way and just saying, hey, we can do this.
Were there specific issues that you wanted to work on that influenced you making the decision to kind of land on Congress as the level of government that you wanted to kind of shoot for? Matt shared with us that he was very specific about wanting to, get involved again, I guess, at the specific local level because of what was happening with the pandemic in that moment. So was there anything like that for you in your decision to run for Congress?
Yeah, it's health reform nationally. I'm on the state Medicaid board in Virginia, so I kind of see how it's impacted at the state level. Of course, still practicing clinically at the University of Virginia. And so seeing how it's operating locally, but just recognizing we're all subject to these forces that are north of us. And so, I think that's an area of my expertise. I'm the director of health policy and equity at the UVA School of Medicine. I teach classes on the Affordable Care Act and its impact. And so recognizing like, hey, what's the skill set we need to navigate this next window? We've had these 10 years of Obamacare, so to speak. And so what's next? And just saying, hey, I think I can lend some expertise to that. So that's what it was for me, I think, legislatively, but also, social justice work, racial justice work. For me, I'm a health equity champion. That's my passion. And so also recognizing the moment and seeing that even before it became the moment that we're in today.
Right.
Hey, marrying these things, this moment for healthcare and this moment for social justice, it's the right time.
Matt, what about for you? Was there something that when you, apart from, what was happening with COVID, was there something personally for you that was happening or professionally that was happening for you that also influenced your decision to kind of run for this particular office when you did?
Sure. I've found ever since I tried to run for the legislature right as I was leaving my residency back in 2006, I did not win the first time, so keep trying. And I've also run and lost a couple times for Congress in Southern Arizona.
Oh,
I really actually I find it really rewarding to do the not just health policy, but a lot of different type of policy, and to take the medical expertise, that background, and use that to foster relationships, communicate, connect people to resources, obviously, but to really build. I think it like when I wasn't serving in some sort of role or involved in advocacy. I love what I do I'm a nocturnist. I'm a nighttime hospitalist here, and I see. Oh, right on. Yeah, I see. Shift-based work makes it easier for sure. And I mean, I see how not just the pandemic, but how like a lack of understanding of health insurance, a lack of health insurance at all, like before the Affordable Care Act, especially. I see how all that impacts the community that I serve. And my district is nearly 50% Latino, about 5% African American. And like these communities, especially Latino communities, are so disproportionately affected by name a disease. It's obvious with the pandemic. I mean, I'm admitting 10, 12, 14 patients every night during my night shifts, and a much larger proportion of them are Latino than should be based on the demographics of my area. And so just that as one example, I think it's so important to have trusted voices in positions of authority, not just where we can go to a legislative body or governing body and appeal for those people who are elected to listen to us because we're experts, because science and facts were sort of in question there for a minute, but where you can go into the cloakroom with other members because you're a member yourself and say no, we need to talk about this. And that's we need healthcare professionals in the halls of Congress and in the halls of our legislatures and on our local boards and mayors and councils as well, because I think they have a skill set that a lot of other folks don't have just by virtue of their training.
Mm-hmm. This is an aside, but I have another question for you. And that is, do you feel like you being a physician lends credibility when you're in public office, or do you think you being a politician actually distracts from or undermines credibility as a physician in the community, or both?
It is very interesting. I noted, like, when I was in the legislature, haven't been I'm on my third week now on the county board of supervisors. So, but in the legislature, like, the most interesting thing about me was the fact that I was a medical doctor, and so I was the only practicing one out of 90 out of the Senate and the House in Arizona. So I literally took care of people, Democrats and Republicans. I sent a Republican colleague lights and sirens to the local emergency department to have an emergent appendectomy.
Wow.
She didn't want to go. I made the sergeant at arms basically pick her up and take her to like his squad car, and he took her in. I diagnosed a Democratic colleague with a DVT that his own, that another provider had missed, actually, and wrote a prescription, because this was 10 years ago, sent him to get the vascular study, and he called me, there's like a clot in my leg. I know, I kind of figured. So anyhow, so on the legislative side, they were fascinated by the doctor thing because no one really did that. And then on the other side, it's like these worlds don't overlap. There's the Venn diagram. There's not a lot of overlap, right? So, and that's why on the medical side of things, they see my name in the paper from now, and I get interviewed from time to time nationally or locally on the local news. They see me a lot. Patients sometimes don't believe I'm me, which is kind of funny. Like, I'll say my name, like, oh, you have the same name as one of our local doctors who's okay, well, it's me. And I've actually had arguments with patients, not arguments, but when like, I'm like, this is a really strange discussion to be having. This like, guy with a COPD exacerbation when I was running for Congress in 2018 was like, just kept laughing when I was like, that's me. I'm Dr. Matt Hines. He's like, well, you might have the same name, but I don't think you're the same guy I'm talking about. I'm like, okay, all right, well, you do. Very nice to meet you, sir.
Interesting.
So no, but yeah, my colleagues are fascinated by this as well. And I think it's made some of them more it's activating for Democratic leaning and Republican leaning folks, just doctors, nurses in general, to see one of us doing this. It inspires them to pay more attention to.
Yeah, no, that's great. I mean, I think this is part of why we feel so strongly committed to supporting doctors to run for public office, is that we do think that there aren't enough of us who are at least, more progressively minded. It is true that when you have people modeling it, that other people will follow. So, okay. So Lisa, how about you? So same question to you about a personal experience or why you thought you were the person to run for this particular position.
Yeah, so I've been really involved in gun violence prevention work with Moms Demand Action for Gun Sense, which probably you guys know about that organization, especially since it has just kind of done amazing work since it was founded. I think it's been 7 years since Sandy Hook. And I really found that when I was, I was in leadership roles with moms, we were spending time at the state capitol. And I kind of like every once in a while, I'm like, oh, I'm also a pediatrician. And people would be like, what? Like legislators. And I kind of like, it's so funny. It just felt like the worlds were separate, which is silly, of course, now that you think of it, because especially if we talk about safe gun storage or, suicide, especially among youth and things like that. So I started marrying it a little bit more. I did a curriculum on how to talk to physicians on safe storage. And I was always really fascinated with the state level, because that's really where the Moms Demand Action work happens. And then, and I knew our state legislator, and when she decided to step down to run for something else, I thought about it for a few weeks. I was hesitant, but both my kids my youngest had just left for college, which I think was a big personal factor in me feeling I could do this now, even though, when my sons were in high school, they didn't necessarily need me, and they probably, would have been just as supportive in high school as they are in college. So it really felt like things aligned. And I will just say that Moms Demand Action, my volunteer friends from that group, they are why I won, more so than any physicians. I will tell you, my partners in my practice, I still see patients 1 day a week, aren't quite sure what I'm doing. And then there were some times in the campaign like, hey, how was your weekend? I'm like, I knocked 100 doors a day for, and it was just really, and they're, they've been supportive. They're helping me switch my schedule around, but I don't think they really quite get it. It's kind of fascinating.
Yeah, I mean, I think this is also another reason why we feel like we need to do something in terms of connecting physicians who have run or who are, in public office or who, formerly were there. Is that we don't have a real community of people who have served, who are physicians. And I think it is so helpful to have that community.
Yeah.
So that's where we're attempting to build, right? With like things like this, where you all meet each other. We actually have a Facebook group, a small but growing group of people who have formerly occupied public office or are currently serving or have been candidates. And I think it is essential, I think, for us to continue to grow the number of physicians that we have representing us. Okay, so one barrier, one success for each of you, and anybody can go. We can popcorn style this one.
Well, I will just say I was in a very competitive Democratic primary. I had several people, including a previous Democratic governor of Oregon, saying there's no way you can win. I had a lot of people tell me there's no way I could win and that I should drop out. There was kind of an establishment candidate who got a lot more money, got every endorsement. And, I think part of being a physician, I mean, you just get out, you just keep going, and I did, and I'm really grateful I did. And there are people who say, well, you won because of COVID. And I would say that's pretty insulting to the voters. But when COVID happened, I did, as you guys, I'm sure did, I retooled my campaign to be just an information machine on COVID. I did press releases on the important, on calling on the governor to call for universal masking. So huge setbacks, attack ads against me by other Democrats, but just kind of persevered. And then the general election was much easier because I'm in a pretty blue district. But Yeah. So yeah, felt really good about the campaign we ran. Really grateful for my Moms Demand Action volunteers. Seriously.
Yeah, those coalitions are key. I think until we
Yeah.
have a great, community of people who are supporting us too, which is another important factor. Like doctors in general, they don't vote as much as they should.
Right.
They don't donate, right?
They
Which is
don't
really
donate,
important.
right. We had to vote until Physician Women's for Democratic Principles.
Exactly. Yeah, that group has been amazing.
Yeah, I know. We spent time with Cameron on that too. So that was through that group. So yeah.
Excellent, excellent. So how about Cameron or Matt? Same question about barriers and successes.
I mean, one barrier for me was just I continued practicing clinically. Like Matt, I'm a nocturnist. I actually became a nocturnist because of politics, and I think it was just like it just made a lot of sense. And so, and I mean, I'm a bit of a glutton for punishment, but I would campaign all day, work overnight all night, wake up and you still have that burst of energy the next morning, get a couple more things in, crash for a few hours, go back to work. I worked in pairs of nights, so I do 2 nights at a time. But I didn't break stride very much, and it allowed me to do a few things. And the other challenge was that, similar to what Matt was saying, I plastered my face all over television for months on end. And so, I walk in patients' rooms, Democrat or Republican, and they're just like, Dr. Cameron Webb, oh man. That's a unique dynamic as well. And again, I work on the COVID unit, so they're like in the middle of 6 liters of oxygen with COVID. And they're like, I've got you as my doctor. So it's been that was also interesting because that was something for our group to navigate, and also I think that's where being a nocturnist had its benefit because it's not the same continuity like when you're on service for 7 days at a time. So that the clinical aspect of it was just something that needed to be navigated, but I think that, by and large, physicians really came through for us. We cultivated a lot of physician donors from all over the country. And I think that was really, really key. I think just, I was learning as I went. And I think that a lot of people picked me up, carried me, a lot of, legislators, individuals all over, just kind of showing me the ropes. And so I ran for 19 months. I was in this race. And so it was a long haul. But I think along the way, I picked up a lot and I gained a lot of really fantastic mentors.
Excellent, excellent. Matt, how about you?
So I would say, I think we have some of the same barriers. I would making sure to educate our colleagues about why political giving is really important, because they don't get it, and that takes a long time. And having a couple of prior congressional campaigns really set me up well to do the county race. It's first of all, it costs 10 times less, which is nice. And then, so a lot of the folks that were willing to donate were kind of used to doing that. They didn't have to, ask if stuff is tax deductible and all this other stuff that they just, here's $50. Are you, excuse me?
Right.
How important is this to you again? Because I need more 1,000. So or something maybe can we do 50 a month for her? I mean, so but yeah, so definitely that would be a barrier. The clinical work also a barrier. Just being in the legislature with at least for 2 of my 4 years in the state house and I was only in the house, a very, very Republican House and Senate. There were, I think, 21 Republicans in the Senate, 9. Now U.S. Senator Kyrsten Sinema, who is one of my colleagues, said at the time, this is a single pizza caucus, right, of Democrats in the Senate. So big barriers to getting stuff done. But I would say I was able to, with Governor Jan Brewer at the time, not exactly, a progressive or a Democrat, but I was able to get to expand our Medicaid program to include middle to low income women with cervical and breast cancer diagnoses. They had so much red tape to basically nobody could actually get into the system. And there was all this available federal money. If the state put in a little bit, it's 4 or 5 to 1 matching or some ridiculous amount of money. So working with a Republican, actually she just unfortunately, a Democrat took her seat, which I like, but it's so hard to find middle of the road moderate Republicans to help get reasonable things done that another part of me just kind of regrets having her not there. But working with this legislator, we were able to get basically unanimously this bill through, signed by the governor, and they like brought another $8 million to the state just for these, and it's helped hundreds and hundreds of women over the past decade that it's been in place. So that's, you know, it's nice to see sometimes that kind of thing, even in a very difficult political environment, with budget cuts left and right, we were still able to like work together in a bipartisan way to get something done that really has had an impact on people in the community.
That's great. Yeah. Let me see if we have any questions. I had one question, but I don't know. Do we have any questions right now from our audience people? Maybe not. Oh, what was the question I was going to ask? Now it is escaping me. I don't know. Is there anything else that you guys want to share? Like, I think that the decision that a lot of people have before them is really trying to figure out like what they want to run for. Like they you know, decide that they want to run for office as a way of making change, because of course that is only one way of making change. You know, you can be like an activist outside of the system. You can donate to causes. There are many things that physicians can do to be civically engaged, to be, you know, politically active, but not run for public office themselves. But the ones that decide that they want to do it, first of all, I think often people think I'm going to run for Congress, right? Like that's what I know. And, you know, that's what has the greatest visibility often. But I think that physicians are really well positioned to occupy every level of government. Like you can make an argument for every level of government why it's good to have a physician there. Yeah, I guess the question that I had was about neutrality. Like my perception was always that this is something that physicians can leverage when they serve. I don't know that coming out of a really politically contentious period that is still true. Like, I don't know if the perception is you're either like Rand Paul or you're like super activist, like progressive physician, right? Like, I don't know that we still are able to say like, we are scientific thinkers, you know, we are rational, we are compassionate as well. We marry reason and you know, and compassion. Can we still do that? Do you think where you guys are each serving at your different levels of government, Cameron, when you go on to serve as part of the COVID-19 task force, do you think that you can still leverage that kind of like neutral authority?
Well, I would say I would like to think so. And I do, you know, people do talk about, people do ask, you know, how will you be able to reach across the aisle? And I did kind of what Cameron said, you know, I've walked into so many exam rooms where, you know, I don't really know that person very well, and we're able to make a connection. And granted, it's easier to make the connection where we're worried about a 4-year-old with a fever, but I do think that I try not to walk into situations with preconceived notions. And then, of course, the science background. And I just do want to reiterate, obviously, there's so many ways for physicians to get involved. I love, Donna, how you wrote that you called into Georgia using both your Korean and your Spanish, you know, I think it's really powerful. And I know when I've gone door to door for other candidates and I mentioned like, I'm out here because I'm a pediatrician and I really care about child health and blah, blah. And people are, I mean, not that I want people to be in awe of me because I'm a physician at all, but it's a little bit like, wow, it gives a little bit of credibility to the candidate as well, that, you know, we are people who, you know, I think are somewhat respected in the community, and let's use it, you know.
Mm-hmm.
For sure. I think that's right. And when I ran for the legislature, wow, like 14 years ago now, my gosh, 12 and 10, that was one of the things that like, I didn't say, you know, I didn't actually even use my own title, but it was on like the little cards I was passing out, and people would, again, kind of, I looked quite a bit younger, but people were like, wait, so you're this guy? And I'm like, yes. And they're like, but this guy's a doctor. I'm like, and I am as well. And they're like, oh, okay. I think there's still some significant trust, I think, for physicians and healthcare professionals in the community. I think it's maybe diminished that compared to what it was, but it's still there. And I think they know that we're pretty busy, especially in a pandemic. So I wasn't doing that kind of door walking, don't worry, in the pandemic. But so that I think impresses folks. And I think to Donna's point about figuring out how to be, how to advocate, how to help your community, your patients, all that. It just kind of depends. I looked at the state legislature. Initially, I did say, oh, Congress, this is a great idea. Former Representative Jim Colby retired in 2005, and then some woman named Gabby Giffords. Oh yeah, that's my district. So someone who ended up being a representative, and of course now her husband Mark Kelly, who I sat next to on an airplane very recently, which was kind of wild. He was going to override the Trump's veto of the defense the defense bill. So anyway, but like, it doesn't have to be Congress or even the legislature. It can be a lot of different levels, and mostly you have to make sure that you have that support and ask yourself the kind of, I'm sure this is all over the interwebs, but the what do I want to run for? Am I qualified to do that job if I even get it? Can I get the job? And there's a couple of ways to look at that. Can I raise the money to do it? Can I afford to? Can my family and myself, can we afford to do this? Will my family support me? So you have to have a lot of those conversations before you just like jump into something. Local school board is a good way to start for some people. Not directly healthcare, but they don't really pay usually ever. But that's a way to kind of get going too. So I think it's important to have that kind of conversation just to kind of see what makes the most sense. And one of my very early legislative advisors and friends, colleagues said, and one of the most important questions is, okay, can I get this job? If I get this job, do I actually want to do this job? That's another, it's very important. I'm not making a joke. I think it's really because a lot of people look at the school board maybe, or the legislature, and like, oh, like almost at every turn, you're going to be pissing off somebody, especially on school board sometimes. And maybe you don't, maybe you don't want that because you're going to get yelled at sometimes. And sometimes, that's fine. But so if you are successful, are you okay with actually having to show up and work with the people you're going to have to work with in the legislature or on that school board? And that's an important part of the equation as well, because that work is going to be incredibly important.
Cameron, any thoughts?
Yeah, I think just a couple of things. First, I would say, you want to go into it eyes wide open, but also don't be afraid to fail. And, saying that as somebody who lost my race, but also, heading into it the entire time, I knew I was running in a district that heavily skewed to the right. And I knew that what was important was the process, and the outcome, we leave that up to the voters, but it's the process and it's the way that you engage. And so when I say don't be afraid to fail, just recognize that in politics, that always is one of the potential outcomes. And you just have to put your best foot forward and be comfortable with the race that you run. And so that at the end of it, you're just like, well, I ran as me authentically as hard as I could, and, kind of leave it at that. And the other part of it is, as physicians, we're in a space societally where you do have something to lose. I think that, for a lot of people, they worry about, well, my standing in the community. Like, I remember for me, I actually was the commencement speaker at UVA like a month before I announced my campaign. And so it was just like, I was, in a good spot in terms of I had to do a lot of community. I really consider myself a healer, and I think I always go to the spaces where we need healing. And I heard Rochelle Walensky, the new CDC director, say the other day that, as physicians, we run to a code, right? We always go to a code. That's what we do. And I think that that's kind of what it is. And so as long as you feel passionate about what you're doing, and you run as yourself authentically, you don't try to play a role, you don't try to be somebody else. I can't tell you, because I'm, young looking and thin, people were just like, Obama. And I was like, nah, Cameron, right? And I think it's important to always just channel who you are and not who people project, you to be. You're not playing a role. Be the first you. And I think that if you do that authentically, you'll be fine. And I just I see Esteban's question in the chat about any concern for my own children, given the political climate. The political climate's ugly, but I think you don't have to match how ugly it is, right? And so I think for us, we ran a very heart-filled campaign focused on positive energy, and that's what we got back all over the district from the deepest red of places. They were like, you seem like a nice guy. If only you were a Republican, right? Like, that's what I And so I think that, we didn't have those problems, but I think that I did it the same way I do with challenging patients. I won them over with kindness, with compassion, with caring. So.
Awesome. Well, I think that's a great way to end. I think that was the big question that we had from the audience. I'm so grateful to all of you for joining us. I know that you're all super busy, and we were running a little bit late today. But thank you again. Good luck with good luck to all of us, actually, because you are serving our communities as our representatives all across the country. And thank you.
Yes, and I'm more than willing to talk to anyone who's interested in running for office. And if you are, one last plug, if you're a Democratic woman, if there's an Emerge chapter in your state, it's a training program for Democratic women running for office. That's really valuable too. But thank you so much, Donna. Thank you for doing Doctors in Politics. Nice meeting you, Matt, and seeing you again, Cameron. I've been in a few events with you already, Cameron, but best of luck on COVID. Please fix it.
I know. Yeah. Bye-bye, guys.
Thank you.
Thanks.
Bye.
Thank you.